All right, good afternoon to everybody. This is the Diabetes Prevention Program question and answer session. There's not much of an agenda, but I did want to take some extra time for those who didn't get a chance to see the Facebook Live last week about diabetes prevention, a little bit about the program in terms of introduction. And what we're hoping for this is to be able to answer some specific questions before we get started next week. So if you haven't had time to see the Diabetes Prevention Facebook Live, if you go to the NMHS Facebook page, you'll see me doing the Facebook Live about diabetes prevention. So the Diabetes Prevention Program is a year-long program geared toward people who are at risk for type 2 diabetes, although we don't exclude people who have type 2 diabetes or people who may have other relationships to type 2 diabetes. We've had in the past some participants who were wives of men who had type 2 diabetes, and also children of people who had type 2 diabetes. But the program is a year-long behavioral lifestyle change program that that's focused on those simple things: a little bit of weight loss and regular physical activity to prevent type 2 diabetes. We've had to change because of coronavirus. The program is ideally done in person. Since April of last year, we've moved to an online format. And this year, this is the first time we've done it in this format, in which we've done it in WebExes. We're hoping to maintain some interactability, although we may not be able to have people video conferencing in for privacy reasons, since we're going to be recording the sessions. But the upside is that the sessions will be recorded, so that me and some of the facilitators of the program will deliver the content, will allow participants to interact with us through the chat features. And so what we want to do is, as questions come up, enter those in the chat box, and that way we can make sure that we're tracking the questions, and it can help me as a presenter and those who are helping us to make sure that we're answering every question. Also, there may be some times where we're asking for some feedback. So using the chat function to provide that feedback. We're still new to it, so we hope to get better with this over time. A little bit more about the program, and I'll actually share my screen to show you what the program entails. So it is a year-long program, and we're starting. So the official start is going to be next week. It's a year-long program that we're going to do in this hybrid, virtual interactive manner, but we will have recorded sessions for you to take a look at on your own time, or if you missed some of the sessions. And here you'll see an outline. The sessions are common in the first 4 months, so having sessions every week for the first 16 sessions, and then the sessions will spread out to twice a month, and then ultimately at the end that will be once a month session. The curriculum for the diabetes prevention program comes from the Centers for Disease Control Diabetes Prevention curriculum called Prevent Type 2. And it's a great curriculum to help us meet the goals that we set, the little bit of weight loss and the physical activity. But it talks about things that other factors involved in making lifestyle changes, things like stress management, coping with triggers, what to do when you're away from the house, a little bit more about diabetes and carbs and how to shop. And so it's a really well put together curriculum. And when I say we, myself and the Nurse Practitioner Fellowship Program from North Mississippi Health Services, We will have fellows that will help me and the coordinators of the program, Rebecca Cook and Rebecca Cagle and Angel Justice, who are the director and the coordinator for the Nurse Practitioner Fellowship, respectively, to help deliver this program. What we want is an interactive program and not necessarily lectures. And so what we hope to do is to try to keep the presentation part short, to try to continue to promote interactions. In past years, we've had special guests, we've had dietitians, we've had exercise specialists join us to help lend some of their expertise. We have in the past given incentives to participants to help support them along through the program. We know that for some, the year-long program may not work, and so we're open to people dropping in. We hope that people can drop in, but more than that, we hope that we can have a group of people that will start the program on January the 12th and will be able to finish the program on December 7th. And for those people, we'll ask a little more of those folks, but in a way to help them meet their goals. We will ask for some accountability in terms of recording their weight for each session, as well as tracking activity. So tracking weekly activity and submitting those things. It's not required, but we encourage tracking food intake. We know that people who track food intake are more likely to make nutrition changes because they are tracking. And so we are, those will be the tools that we ask of those people who are interested and would like to participate in a year-long program. The best part of the program is the relationships that develop into the program and how much we can learn from each other as the participants. It'll be different this year, but we're still hoping to be able to deliver a worthwhile program until that time that we can get back in person. Ideally, the program will be done in person, but safety requires us to do it like this time. So you see the schedule, and again, we hope for you to attend or participate in most of the sessions. We also know that life happens, vacations and illnesses and work and things like that. So we will actually have sessions recorded. And so this schedule you will find on the website. So if you can look at the browser here, and you'll see the website is our diabetes prevention program. I'll keep it there for a little bit so that you can take down the website to get you to the diabetes prevention program website. We're fortunate that this is the first year that we've had the website, and you'll see more information about the program, the time, our contact information, as well as email. And we ask that if you're interested in participating in the longitudinal part of the program, to send us an email at diabetesprevention@nmhs.net. The rest of the site, you'll see links to things like our weight log, our schedule, which I just showed you, our fitness log. There's action plan journal, which as we go into the program, we'll tell you more about. As you scroll down, you'll see the sessions again, but you'll also see the link to join. So if it's the day of the session, clicking on that link will take you to the WebEx for you to join the current session. After the session has been done, if you go back, you'll have access to a recording of that session. And as we get into the program, you'll see that we have the participant handouts that are available to you. This is an example of the participant handout for the session 2 weeks from now. And it's been arranged for the whole program. And so at your fingertips, you have access to all the sessions. the useful resources, as well as the links to join the program. You'll have information on North Mississippi website. So questions, there's more information about where to find us, what happens if you need any help, and things like that. So we will, we'll get started next week with the introduction session where we talk more specifically about the program. In this session, it's not very structured today, but just to answer any questions. And for the fellows who are on the call, go ahead and ask any questions that you have, because ask any program questions that you have. So I'm going to go back to let that sit for a while on the website so that people can see the web address. It's too long for me to say. And if you reach out to diabetes prevention, which is a simple diabetes prevention at nmhs.net, we can actually email you more information or answer any questions that you have. And if you want to call us, the number is 377-5767. Okay. So I'm going to stop sharing the screen for a second. I don't see any questions in the chat box, but I am open to questions. So if you're on the call, you can unmute and ask your questions, or unmute or ask your questions, or you can put the questions in the chat box.
Hi, Dr. Rayford.
Hey.
Hey, so how long does the sessions usually last?
That's a great question. So, yeah. So the sessions are ideally less than an hour. So over the last couple of years, we've really stuck to it. So we've been 45 minutes or less.
Okay.
And I anticipate the sessions will be potentially shorter because of the format this time, that we're going to be doing interaction through the chat box and things like that. And so I anticipate each session being about 30 to 45 minutes, where we are, and each session, like I showed earlier, each session has a handout in a particular topic, and the handouts take you through the different topics. And so what we do is we'll go through the sessions, ideally having a lot of questions, asking about the different accountability type things for people to report, and then we tried hard to be really respectful of people's times.
Dr. Rayford, it's Rebecca.
Yes. Hey.
Describe to them the success of the program, the research, or what going through a program like this, how it helps.
Yeah. So the lifestyle interventions, so a little bit of weight loss, and that's usually 5 to 7% weight loss. So if you weigh 200 pounds, that's 10 to 14 pounds. So losing that weight in 6 months, keeping it off the next 6 months, getting 2.5 hours of moderate to vigorous physical activity, that reduces your risk of diabetes by almost 60%. So for those people at the highest risk of having type 2 diabetes, a program like the Diabetes Prevention Program with those goals can reduce that risk of progressing to type 2 diabetes by almost 60%. And that's almost double the reduction that happens with metformin, which is the most common medicine we use for diabetes prevention. So it reduces the diabetes risk by about 31%. And so the lifestyle interventions are twice as good as the medication, and that's actually really powerful. And the diabetes prevention program, the the magic or the key to success is the curriculum. Key to the success is helping people realize that there are more factors to lifestyle change than that advice to eat less and exercise more. So that there's a lot to it, and each person is different, and the sessions help equip people with the tools to achieve those goals. Not only do people get benefits in terms of diabetes prevention, so there's weight loss, there's physical activity, there's also just new things that you learn. Our program in particular, there's sessions where our dietitian has helped provide alternatives to our favorite food. So, healthy ways to enjoy our favorite foods. There's been exercise specific sessions that, we have access to people that can help lead us through different types of exercise. Our incentives for our program. And then there are other benefits that people can get from the goals of modest weight loss and regular activity. So people can find themselves on less blood pressure medicine, less cholesterol medicine. People's blood sugars can improve. People can lose significant weight. We've had participants lose significant weight and completely reduce their blood sugars from the prediabetes range to the normal range. And we've had people maintain those changes. Not only, you also get the benefits of that weight loss and that physical activity, like in terms of people with joint pain can find their joint pain is better. It can, there's just so many benefits from the lifestyle change program. So I have a question in the chat box that says, will there be weighing in once a week for the first 16 weeks? And the answer is yes. So the answer is yes, that's part of the accountability that helps with the program. When we're in person, the weigh-ins are done prior to the session. What we're asking the participants who are interested in the longitudinal part to submit their weights. So to do it in a secure fashion, the weigh-ins are private. They're not public events. Some programs have public weigh-ins. We don't do public weigh-ins. These are confidential weigh-ins where only the participant and we who are administering the program know. And that's for a couple of reasons. One, the weigh-ins are a form of accountability to help people know how they are meeting their goals. And two, to deliver the program, we also collect data and we de-identify the data to submit to the Centers for Disease Control so that we can achieve full CDC recognition. And so we actually have a data collection part. And again, it's de-identified data to in our application for full CDC recognition. Another question was, although this is intended for prevention of type 2, can you briefly point out the benefits for a person that already has type 2 diabetes? So, yeah, so the program is really, really helpful because the weight loss, physical activity, improved sleep, stress reduction, helpful nutrition changes, those things can help someone who already have established diabetes. It can help someone improve their blood sugars. And in doing those things, some people can move from controlling their blood sugars with medications to controlling their blood sugars with lifestyle factors. So there are some benefits for people who have type 2 diabetes. We will still deliver the same program, the same group format, the accountability. We wouldn't submit the data to the CDC for people who already have type 2 diabetes, but the curriculum works for people who already have type 2 diabetes, although you'll see that there's a kind of very strong push or strong focus on preventing type 2 diabetes. But a lot of those changes that the program can help participants incorporate into their lives, and those goals can be really beneficial for people who have type 2 diabetes already, or people who have a relationship. So, there are, like I say, we've had a child, an adult child of someone with type 2 diabetes, and we've had the wife of someone with type 2 diabetes participate in the program. And again, there can be, it can be a really rich program. So we've been very accepting to have people with type 2 diabetes. We're not saying, no, you can't participate. We're encouraging those who are interested to participate. As far as the program goes, we're looking at, so particularly there are a couple of groups that we wouldn't necessarily exclude, but it's a group that hasn't been studied in the diabetes prevention program so far. And that group includes pregnant women, and teens and adolescents less than 18. So the program has been in non-pregnant adults 18 and older. So those two groups are ones where the program would, again, we wouldn't, deny membership, but those are kind of special groups that have not been specifically looked at in terms of the diabetes prevention program. Pregnancy, there's a lot more to pregnancy, and what would be prediabetes in pregnancy, what would be prediabetes outside of pregnancy would be managed aggressively inside of pregnancy. So some of the information may not be as relevant, or there would be a different way to manage someone who's pregnant. Okay, so the chat box works. Let's see if there's another. Okay, so please, if question, unmute, ask us questions, or add it to the chat box. So after the first 16 weeks, then the weigh-ins are actually, we space the weigh-ins, at least the official program weigh-ins. Some people weigh in, after they've gotten into a pattern, 16 weeks of weighing weekly. They weigh themselves every week, and we have resource sheets to help people track their weights. But the weigh-in sessions coincide with the diabetes prevention sessions, and so it'll end up being 26 weigh-ins over the less than a year's time.
Dr. Rayford, it's Rebecca again. One more thing of tracking on the activity. I know people do different type little devices and steps and all, but we just ask that you report in how many minutes per week. So of course the goal is 30 minutes a day of activity, but we'll just ask you for the overall minutes for that week for our record keeping.
Yeah. So and that's for our records. Another thing that we report out is minutes per week per participant. So minutes of moderate to vigorous physical activity per week per participant, and that's what we're actually tracking. That's one that we're tracking. We're asking you to count and asking you to report, and we're working on finding the best way to report. Previously, we've used SurveyMonkey in terms of reporting, but we're still thinking about other ways to have participants confidentially. And again, the activity tracking is not, we don't share, we don't post, hey, I exercise, 30 minutes this week. It's not something that we post for, for, publicly. This is another accountability that's between the program and the participant. So we had one question to say, could we speak more to the longitudinal portion? And yes, so what we're looking at for the longitudinal program, we're looking at a group of people that will get started with us in the program in January, attend the majority of sessions, record their weights and record and report their weights, record and report their minutes of physical activity, participate in the program. And our hope is that those people that begin with us is in January, finish with us in December. The best outcomes come from those who have high levels of participation. And we've looking at our just kind of a back of the envelope kind of analysis of our previous sessions. Those people who lost the most weight attended the most sessions, and attended the most sessions, were more consistent at reporting their weights and was more consistent at reporting their physical activity. So we're hoping for those who are interested, we want you to reach out to us at Diabetes Prevention at NMHS. Let us know that you're interested. There's some baseline data that we have to collect, and that includes demographic data, as well as data about starting weight, height, so that we can calculate a BMI, other demographic type data, and then just to know which group we can expect to attend most of the program. We will have incentives and perks for those who are participating in the longitudinal program, just as we've done in the past. We've been able to give incentives to help support people as they are going through the program. To also, and these incentives are not just simple happies. We're not giving Starbucks gift cards and things like that. We're giving practical incentives, measuring cups, measuring plates. 1 year we gave resistant bands, water bottles, and so incentives to. But we're going to hold those incentives for the people who are interested in the longitudinal program, just because of their commitment of their time through the program. So we're going to, kind of look to those, and then we'll find other ways. We're also we're working on ways to have a more, maybe not a recorded interactive way for the participants in the longitudinal section to be able to connect and to help support each other, bring up ideas, but not in the recorded part. And we're working on that, and that's going to be, as we're going through the program, we'll kind of talk about more of how that's going to look. The other aspect for the longitudinal program is so the attendance, the demographics, the incentives. We've had some gracious experts in the past. Our dietitian has actually been gracious in the past to offer dietitian sessions for those who have participated in the program, and that's something we hope we can do for those who are participating in the longitudinal program, to help give access to our dietitian. And again, we're going to talk more about that as we go through the program. There's a question about the average age of the participants. So we've had a pretty good age range in terms of the participants. We've had people in their 20s. And so previous years, most of our participants have actually been older folks. And I'm not going to offend anybody by giving an age range for older people, but I'll say people who are retired. So people who are retired, we've had a lot of people who've been retired, and that may have been the time commitment type thing for the previous programs where the program was in person. So there's been a good age range. The average age tends to be more toward a retirement age. Um, retirement age. We're not sure at this time what the participants in this program. So what we're going to call this is our 2021 cohort. So we're not sure of what our 2021 cohort will look like. My hope is that we'll have some nurse practitioners from the fellowship who are interested in the longitudinal aspect, both from a programmatic standpoint and a participatory standpoint. We're hoping to have some of the MP fellows to kind of also be in the longitudinal portion to again to see what it's like and also to help us craft the program toward the participants. Our hope is that we'll have a good number of participants. When looking at feedback from other diabetes prevention programs, when they were looking at the in-person group format, there seemed to be a magic number in terms of the group size, anywhere from 7 to 15. That was kind of seemed to be the best number for the group in terms of interactions and the cohesiveness of the group. It's going to be different with this session. So we're going to learn, we're going to learn as we go. It's going to be an iterative program. And so we're going to learn as we go, but we do incorporate those things that we've learned. So we're not, we don't want to keep, by December, we don't want to be doing things in December that we found out didn't work in February. So what I'm going to do is I'm going to put the diabetes prevention email in the chat box, as well as the link to the webpage. And I encourage you to go to the webpage to learn more about the program. Please reach out to us if you have any questions about the program, any concerns about the program. We will have the next session next Tuesday. And for those, if you're not sure, just show up. Participate, dial in on Tuesday, learn a little bit more about the program in terms of the specific tools that we're going to use with the program, where we're actually going through and showing you the tools, how to come up with an action plan journal and some more things about the program. See if that's something that you will find helpful. We hope that you will. And again, we hope that you get started with us in January and we can continue the program through December to help you meet your goals. Any more questions? So, and again, I want to tell you that we will be really, really respectful of your time, so that if it's 25 minutes, if it's 30 minutes, we'll kind of be really respectful of your time. We don't want to stretch things out. We realize that, time is a precious commodity for us all, even though, our day-to-day lives are different. Our time is still a precious commodity. And so we don't want to, we don't want to not value each other's time. And so program, you rarely have a program over an hour, and in fact, 45 minutes is usually the time that I try to not go beyond.
My last little parting comments, Dr. Rayford, are to encourage everybody to find their why. I know that this year's been different for everyone, and We've certainly learned that diabetes and other risk factors put one more at risk with the COVID and not so good outcomes sometimes. So it may be something down that nature of you just want to overall get healthier, other health habits as well, tobacco, anything that you want to change. But it's kind of such a personal thing. Everybody's got to determine, why am I doing this? You may be alongside somebody that you're helping in your family, like a family member attending with someone to be able to help them better, or have the whole family eat alike or do alike. But finding your why is one of those ways that'll kind of keep you going on the days that maybe seem harder, or, oh, I've got to get home, I've got to get logged in, it's time, I've had a crazy day at work. But find that, and that will generally carry you through. And being a binder person, I print all the handouts each week and make myself a little 3-ring binder so that I can look things up that I want to, just build it as you go. And then you'll have everything at your fingertips. Of course, it'll still be on the website as far as I know, or you could look it up on the CDC website, but sometimes having it handy, or just depends on which way you like to have your information.